grade, chapter 14 real quick, and I believe we're doing evens, correct?
Yes.
Okay. All right. 2 false, 4 false, 6 false, 8 true, 10 true. 2 true, 4 true, 6 true, 8 true, 10 true. 2L, 4G, 6A, 8B, 10J, 12D. Word parts, you should have 2 answers. 2 heart, 4 fluorescence, 6 visual examination, 8 instrument used to record X-ray film, 10 one who studies and practices, a specialist, 12 transparent, 14 sound. Number 2, to diagnose and treat disease. 4, images can be taken and viewed immediately and then sent electronically to a network of computers. The images can be saved on a CD or DVD and given to the patient to take to his or her physician to review. Or 6, to provide a contrast and density between the tissue or organ and the surrounding area to make a structure visible on a radiograph. 8, with the anterior aspect of the body facing toward the radiographic tube and the posterior aspect facing toward the radiographic film. Number 10, they may contain small amounts of metal that can be seen on the radiograph and may interfere with interpretation. 12, to measure the bone mineral density of the human skeleton for means of detecting bone loss. 14, post-menopausal women. 16, indicate if the patient has lost bone density, assist in detecting the presence of osteoporosis, can be used to predict the patient's risk of bone fracture, indicate if therapy is working properly for patients undergoing medication therapy for osteoporosis. 18, food and fluid have a degree of density and could cause confusing shadows on the radiograph. 20, polyps, cancerous tumors, diverticulosis, and the extent of inflammatory bowel disease such as ulcerative colitis and Crohn's disease. 22, the air distends the wall of the colon and allows the colon to be viewed in greater detail, making it easier to detect polyps and small cancerous tumors. 24, kidney stones, blockage, or narrowing of the urinary tract and growths within or near the urinary system. Number 26A, angiocardiogram, a radiograph of the heart in which the valves and vessels are examined by X-ray and fluoroscopy after introduction of a radiopaque contrast medium. B, bronchogram, a radiograph of the lungs taken after introduction of the radiopaque contrast medium. C, cerebral angiogram, a radiograph of the major arteries of the brain taken after injection of a radiopaque contrast medium. D, coronary angiogram, a radiograph of the coronary arteries taken after the injection of a radiopaque contrast medium. Cytogram, a radiograph of the urinary bladder taken after injection of the radiopaque contrast medium. 28. It shows movement, allows for continuous viewing of a structure, and uses sound waves rather than radiation. 30, to increase conductivity of the sound waves between the skin and the transducer. 32, blood flow blockages, narrowing of blood vessels due to arteriosclerosis and congenital malformations. 34, to detect and evaluate tumors and other abnormalities and to monitor the effects of surgery, radiation therapy, or chemotherapy on tumors. 36, to assist in the diagnosis of intracranial and spinal lesions and cardiovascular and soft tissue abnormalities. 38, radioactive materials known as radiopharmaceuticals. 40, to detect small fractures such as stress fractures or lesions that may not be visible on other diagnostic imaging examination. And 42, brain cancer and heart disease. All right, make sure you send me your results. And then everyone needs to turn to chapter 20 on page 714. All right, any questions before we start on this part? Okay. All right, that's fine, Anna. Thank you. All right, Alicia, can you go ahead and read Introduction to Microbiology, the first and second paragraph?
Okay. Microbiology is the scientific study of microorganisms and their activities. As described in Chapter 2, microorganisms are tiny living plants and animals that cannot be seen by the naked eye but must be viewed under a microscope. Anton van Leeuwenhoek designed a magnifying glass strong enough for viewing microorganisms. He was the first individual to observe and describe protozoa and bacteria. Oh my God, you know how to say that? Leeuwenhoek, is that right?
Yeah, that's how I would say it.
Magnifying glass was the precursor of modern microscopes used today to study microorganisms. A microscope allows the observer to see individual microbial cells and to differentiate and identify microorganisms. For the most part, microbiology deals with unicellular or one-celled microscopic organisms. All of the life processes necessary to sustain the microbe are performed by one cell. Among them are the ingestion of food substances and their use for energy, growth, reproduction, and excretion.
All right, so on the first paragraph, you're going to highlight just the first sentence. Jasmine R., are you where you can read the next two paragraphs, please?
Yes. Microorganisms are ubiquitous. They are found almost everywhere in the air, in food and water, in the soil, and in association with plants, animals, and human life. Although vast numbers of microorganisms exist, only a relatively small number are pathogenic and able to cause disease. When a pathogen infects a host, it often produces a set of symptoms peculiar to that disease. Scarlet fever is characterized by a sore throat, swelling of the lymph nodes in the neck, a red and swollen tongue, and a bright red rash covering the body. These symptoms aid the provider in diagnosing the disease. The medical assistant must be alert to all symptoms that the patient describes and must relay this information to the provider through careful and concise documentation of these symptoms in the patient's medical record.
All right, very good. Jasmine C., can you go ahead and read the next three paragraphs? All right, Lily, can you read the next three paragraphs?
The provider is not able to diagnose clinical signs and symptoms. Laboratory test analysis must be used to help the provider identify the pathogen. Identification of the pathogen leads to proper treatment of the disease. Laboratory analysis used to identify a pathogen include the following: biochemical tests, DNA testing, also known as PCR testing, microbial culture. Although the type of laboratory analysis used to identify a pathogen is often performed at the outside laboratory, a medical assistant is frequently responsible for collecting the microbiologic specimen that will be transported to the outside laboratory. This chapter provides an introduction to microbiology, including a description of proper microbiologic collection and handling techniques that must be followed to ensure a quality specimen. Identification of a pathogen using CLIA-waived biochemical testing and microbial culture is also discussed. DNA testing to detect pathogens was described in Chapter 8. Before undertaking this study, the medical assistant should review Chapter 2, which discusses introductory concepts that are basic to this chapter.
Very good. Okay, so I want you guys to highlight where it says laboratory analysis used to identify a pathogen include the following: biochemical test, DNA testing, and microbial culture. All right, Natalie, can you go ahead and read? That's okay, Jasmine C. Go ahead and read normal flora.
Every individual has a normal flora, which consists of the harmless microorganisms that normally reside in many parts of the body, but do not cause disease. The surface of the skin, the mucous membrane of the gastrointestinal tract, and parts of the respiratory and genitourinary tracts all have an abundant normal flora. Some microorganisms that make up the normal flora are beneficial to the body, such as those that inhabit the intestinal tract that feed on other potentially harmful microscopic organisms. Other examples are microorganisms found in the intestinal tract that synthesize vitamin K, an essential vitamin needed by the body for proper blood clotting. In rare instances, if the opportunity arises, for example, lowered body resistance, certain microorganisms of the normal flora can become pathogenic and cause disease.
Very good. Okay, so I just want you guys to highlight the first sentence. Let's see, Talia, Sabrina, we are reading on page 715 and we're starting on infection. All right, Talia, can you go ahead and read the first paragraph?
Invasion of the body by the pathogens microorganisms is known as infection. Under the conditions to the pathogens, they grow and multiply, result in infection disease, also known as communication disease. They produce harmful effects on the host. Not all pathogens that enters a host are able to persist disease. However, when a pathogen enters the body, it attempts to invade the tissue so that it can grow and multiply. The body tries to stop the invasion with its second line of natural defense. What's it say? Mechanisms, which includes inflammation, pathocytosis by the white blood cells, and the production of antibodies. These defensive mechanisms work to destroy the pathogens and remove it from the body. If the body's successful, the pathogens are destroyed and the individual experiences no advice. If the pathogen is able to overcome the body's natural defense mechanisms and infectious disease results.
All right, very good. All right, so you're going to highlight the first sentence on that paragraph and then highlight the body tries to stop the invasion with its second line of natural defense mechanisms, which include inflammation, phagocytosis by white blood cells, and the production of antibodies. All right, Sabrina, can you go ahead and read the next two paragraphs?
Is it where it says many infectious diseases?
Yes.
Okay, many infectious diseases are contagious, meaning that the pathogen that causes the disease can be spread from one person to another directly or indirectly. Frequently, droplet infection is the mode of transmission of a contagious disease. Droplet infection refers to an infection that is indirectly transmitted by tiny contaminated droplets of moisture expelled from the upper respiratory tract of an infected individual. When an individual exhales, as during breathing, talking, coughing, or sneezing, he or she emits a fine spray of moisture droplets from the upper respiratory tract. If the individual has contagious disease that is transmitted by droplet infection, the pathogens are carried into the air by these tiny moisture droplets. Another individual may inhale these contaminated droplets and become infected with the disease. To help prevent the spread of droplet infections, contagious individuals should cover their mouths and noses while coughing or sneezing. See Figure 2.1 for examples of other means of pathogen transmission.
All right, very good. All right, so on that first paragraph, you're going to highlight the first sentence. And on the next paragraph, I want you to highlight the first and second sentence. All right, let's see here. Alicia, go ahead and read stages of an infectious disease.
When a pathogen becomes established in the host, a series of events generally ensues. The stages of an infectious disease are as follows. Number 1, the infection is the invasion and multiplication of pathogenic microorganisms in the body. And number 2, the incubation period, the interval of time between the invasion by a pathogenic microorganism and the appearance of the first symptoms of the disease. Depending on the type of the disease, the incubation period may range from a few days to several months. During this time, the pathogen is growing and multiplying. Number 3, the prodromal period is a short period in which the first symptoms that indicate an approaching disease occur. Headache and a feeling of illness are common prodromal symptoms. Number 4, the acute period is when the disease is at its peak and symptoms are fully developed. Fever is a common symptom of many infectious diseases. Number 5, the decline period is when symptoms of a disease begin to subside. Number 6, the convalescent period is the stage in which the patient regains strength and returns to a state of good health.
All right. So number 1, I want you to highlight the words, the infection is the invasion. On number 2, highlight the first sentence. On number 3 and number 4, highlight the first sentence. Highlight all of number 5 and go ahead and highlight all of number 6. All right, then we're going to be on page 716. Case study number 1. John Seymour calls the medical office. He says that he is not at the office but would like some assistance. He says that for the past 3 days he's had a headache, fever, chills, and aching muscles. He said that a week ago he pulled a tick off his lower leg, and several days later he found a red rash around the tick bite. He says that he went on the internet and looked up his symptoms, and he is sure that he has Lyme disease. The internet site recommended taking doxycycline for 3 weeks to treat Lyme disease. John says that he does not like to go to the doctor and has not seen a doctor for more than 10 years. He wants to know whether the doctor could call in a prescription for doxycycline for him. He says that he has health insurance and the doctor could bill him for an appointment just as long as he did not have to come in. Okay, so the first part is, what would you do?
It explained to him that it's important that he comes in to be assessed because, just because he looked it up on the internet and it looks like it may be the same doesn't mean that it is. And they have to have his full patient history before they can prescribe him any medications or anything like that.
Yep, very good. Yeah, a lot of people don't like going to see the doctor, right? And they're going to want to try to find out any way possible for them to get treated, but without seeing a doctor. Now, if your patient is established, depending on the symptoms, but this patient is not established, and based on his symptoms, he really does need to be seen, right? There's no way. Yes, make him feel comfortable since he does not like to come to the doctor. Tell him that tests need to be done before we can prescribe certain medications. That's right. Because it may not be that he has Lyme disease. It could be something else. But without seeing him, it's really hard to do that. And when it comes to a rash, a doctor has to see the rash and 99% of the time when they see that rash, they know exactly what's going on, because every kind of disease, right? Like if you have strep throat and you break out in a rash, that has a different rashy look, right? If it's allergies, poison ivy, poison oak, things like that, they all have a distinct look. And in that case, yeah, the patient needs to be seen. Good. Anything else?
Let him know that the doctor can't prescribe him anything without being seen.
Yeah, that's right. All right, what do we not want to do?
Can feel bad or dumb because he's scared to go to the doctor.
Yeah. Yeah, a lot of people have an anxiety over a number of things. Going to the doctor is a pretty common one. Yeah, and we don't, another thing that you don't want to do, and I'm sure y'all may already be thinking this, is that we don't want to make him feel bad. Like we don't want to tell him that he should not be going to the internet to diagnose himself, right?
Don't want to make him feel like we're judging him.
Right, exactly. A lot of people go to the internet, and I have to remind myself, even medically speaking, to not go to the internet because it's going to tell you like you're almost dying, right? And that's pretty much what it is. It gives you every single thing, and it causes a lot of concerns for the patient. But, if that's what the patient's going to do, then that's just what the patient's going to do. So, all right, good. Any questions about that? Okay. Microorganisms and disease. The group of microorganisms known to certain species capable of causing human disease include bacteria, viruses, protozoa, fungi, including yeast, and animal parasites. Highlight those words. Bacteria and viruses are most frequently responsible for causing human diseases and are discussed next. Let's see here. Jasmine R., can you read bacteria, please?
Bacteria are microscopic single-celled organisms. Of the 1,700 species known to dwell in humans, only approximately 100 produce human disease. The discovery of antibiotics has helped immensely in combating and controlling bacterial infections. Antibiotics are not effective against viral infections, however. Bacteria can be classified according to their shape into 3 basic groups. Ground bacteria are known as cocci. Cocci can be categorized further as diplococci, streptococci, or staphylococci, depending on their pattern of growth. Rod-shaped bacteria are bacilli. Spiral and curve-shaped bacteria are spirilla. Spirochetes and vibrios.
Okay. So in bacteria, I want you to highlight where it says bacteria are microscopic single-celled organisms, and highlight of these 1,700 species. Highlight the words 100 produce human disease. Highlight antibiotics are not effective against viral infections. Highlight bacteria can be classified according to their shape into 3 basic groups. Round bacteria are known as cocci, diplococci, streptococci, and staphylococci. Ooh, these words. Highlight rod-shaped bacteria or bacilli. Spiral and curve-shaped bacteria or spirilla. All right, Jasmine C., are you where you could read the next?
Yes.
Okay.
Staphylococci are round bacteria that grow in grape-like clusters. These species, Staphylococcus, I don't know how to say that.
Staphylococcus.
Staphylococcus
Epidermis is widely distributed and is normally present on the surface of the skin and the mucous membranes of the mouth, nose, throat, and intestines. S. epidermis is usually non-pathogenic. However, a cut, abrasion, or other break in the skin can allow invasion of the tissues by the organism, resulting in a mild infection. Do you want me to keep going or stop there?
Yes, ma'am. Go ahead and finish out that one.
Okay. Staphylococcus aureus is commonly associated with pathologic conditions such as boils,
Carbuncles.
carbuncles, pimples,
Impetigo.
impetigo, abscesses, staphylococcus, food poisoning, and wound infection. It's caused by staphylococci usually cause much platelet formation, separation, and are termed pyogenic infections. Oh. Sterococci are round bacteria that grow in chains. Before the advent of antibiotics, streptococcal infections were a major cause of human death. Diseases caused by streptococci include streptococcal sore throat, strep throat, scarlet fever, rheumatic fever, pneumonia. I don't know how to say that. Pneumonia, peripheral
sepsis. Syphilis.
I'm sorry.
No, this chapter's really got some doozies.
And skin conditions such as carbuncle and impetigo, diplococci around bacteria that grow in pairs. Pneumonia, gonorrhea, and meningitis are infectious diseases caused by diplococci.
All right, very good. I'm going to tell y'all right now. I'm sorry. This chapter has some doozies. Okay. So I want you to highlight all of the second paragraph. In the third paragraph, highlight diseases caused by streptococci include streptococcal sore throat, strep throat, scarlet fever, rheumatic fever, pneumonia, puerperal sepsis, erysipelas, and skin conditions such as carbuncles and impetigo. And then highlight the first sentence on the last paragraph. All right, Lily, go ahead and read the next bacilli.
Bacilli are the large bacteria that are frequently found in the soil and air. Some bacilli are able to form spores, a characteristic that enables them to resist adverse conditions such as heat and disinfectants. Disease caused by bacilli include botulism, tetanus, gangrene, gastroenteritis produced by salmonella, food poisoning, typhoid fever, pertussis, bacillary, dysentery, diphtheria, tuberculosis, leprosy, and plague. Escherichia coli is a species of bacillus that is found among the normal flora of the large intestine in enormous numbers. It is normally a harmless bacterium. However, if it enters the urinary tract as a result of oral resistance, poor hygiene practices, or both, it may cause a urinary tract infection.
All right, very good. All right, I'm telling you guys, this chapter's got some doozies. Okay, so you're going to highlight the first sentence in the second paragraph. Let's see, Natalie, go ahead and read spirilla.
Spirilla are spiraled or curve-shaped bacteria. Treponema pallidum, a spirochete is the causative agent of syphilis. This microorganism cannot be grown in commonly available culture media. The diagnosis of syphilis is generally made using serologic tests. A serologic test is performed on the serum of the blood. Cholera is caused by another type of spirillum, Vibrio cholerae. Immunization and proper methods of sanitation and water purification have all but eliminated cholera in the United States.
All right, very good. Okay, so now let's look at something really cool. So this chapter is medical microbiology. So it's going to talk about what some of these microorganisms and diseases, what they look like under a microscope, right? And then what are some common causes diseases with this bacteria? So look on figure 20.2 on page 716. And you can look and see the different patterns that each of these microorganisms and disease, what they look like, okay? Now I want you to look at figure 20.3 on page 717. So A is your staph. That's what it looks like under a microscope. And if you compare it with figure 20.2, you can kind of see those little cells kind of grouped together, right? Just like little round, it says it's grape-like. I probably could do like you could do grape-like or maybe even like a cherry tomato shape, right? Like it's just it's a group. All right, B is your strep. Same thing, it kind of has that little winged look. Growing in chains, that's what that is. C is the bacilli, that's our rod shape, and that's exactly what it will look like. D is our E. coli, and E is the spirilla. That's kind of cool. I mean, all right, so on spirilla, you're just going to highlight the first two sentences, and then we are going to go on over to page 718. Any questions so far? All right. Let's see here. Sabrina, can you read viruses?
Viruses are the smallest living organisms. They are so small that the electron microscope must be used to view them. Viruses infect plants, animals, and humans and use nutrients inside the host's cells for their metabolic and reproductive needs. Infectious diseases caused by viruses include influenza, chickenpox, rubella, and rubella, mumps, poliomyelitis, smallpox, rabies, herpes simplex, herpes zoster, yellow fever, hepatitis, and most infectious disease of the upper respiratory tract, including.
All right. So I want you to highlight just the last sentence. All right, so those are some things that we can view what's under a microscope and what are some, like our diseases and viruses and what they look like. All right, so now we're going to talk about the microscope, right? It's going to break it down into parts and what they're used for. Talia, can you please read microscope?
Many kinds of microscopes are available by the type used most often for office laboratory work in the compound microscope. The compound microscope consists of two lens systems, and the magnification of one system is increased by the other. A source of bright light is required for proper illumination of the object to be viewed. This combination of lens and light permits visualization of structures that cannot be seen with the unaided eye, such as microorganisms in cellular forms. The compound microorganism consists of two main components, the support system and the optical system. The medical assistant should be able to identify the parts of a microscope, figure 20.4, and should be able to use and care for it properly. Procedure 20.1 outlines the correct use of and care of a microscope.
All right, Very good. Thank you. It's okay, Alexis. All right, so you're just going to highlight the first sentence. So when we do get to the lab, you're going to be able to see the microscope, right? You're going to be able to look at it, kind of view it, pick it up, you know, and we're going to learn the basics of it. And it's up to your office if that's something that your doctor does use quite frequently. For example, if you're in dermatology, you will use a microscope very frequently. And it just depends on the practice. But we're going to break it down and find out what are the parts of the microscope and find out the basic use of a microscope. All right. See here.
What did you say to highlight?
Just the first sentence.
Right under microscope?
Yes, ma'am.
Thank you.
You're welcome. All right, Alicia, can you go ahead and read frame and stage under support system?
The working parts of the microscope are supported by a sturdy frame consisting of a base for support and an arm for carrying it without damaging delicate parts. The arm is also used to support the magnifying and adjusting systems. Stage. The stage of a microscope is a flat horizontal platform on which the microscope slide is placed. It is located directly over the condenser and beneath the objective lenses. The stage has a small round opening in the center that permits light from below to pass through the object being viewed and over to the lenses above. The slide should be placed onto the stage. The object to be viewed is positioned over this opening so that it is satisfactorily illuminated by the light source below. Standard microscope stages have metal clips attached to the stage to hold the glass slide securely in place. With this type of stage, the slide must be moved by hand for examination of various areas on it. Other types of microscopes have a mechanical stage that allows movement of the slide in a vertical or horizontal position by using adjustment knobs. The mechanical stage provides precise positioning of the slide, which is essential for performing certain procedures such as differential white blood counts and inspection of gram-stained smears.
Very good. Okay, so under stage, in the second paragraph, I just want you to highlight the first sentence. Now, if you ladies want, you can take a look at figure 20.4. This is a common version of microscope that you may have in your office. That is what it will look like. All right, let's see. Jasmine R., can you go ahead and read light source and condenser?
The light source is at the base of the microscope and consists of a built-in illuminator along with the switch for turning it on and off. The light is directed to the condenser above it and then through the object to be viewed. Compound microscopes have a lens system between the light source and object known as a substage condenser. Popular condenser is the abicondenser, which consists of two lenses used to illuminate objects with transmitted light. The condenser collects and concentrates the light rays and directs them up, bringing them to a focus on the object so that it is well illuminated.
Very good. All right, Jasmine C., can you read diaphragm?
Diaphragm and adjustment knobs, or just diaphragm?
Just diaphragm.
Okay. The amount of light focused on the object also can be controlled by a diaphragm, located beneath or inside the condenser. The diaphragm consists of a series of horizontally arranged interlocking plates with a central opening or aperture. The diaphragm has a lever that is used to increase or decrease the amount of light emitted by increasing or decreasing the aperture. Appropriate intensity of light is essential for proper viewing of the specimens, especially at a higher magnification. A general rule is that as the desired magnification increases, the more intense the light must be. Increased light intensity is required for good visualization of a specimen with oil immersion objective. With the lower power objective, the light must be diminished to produce the appropriate contrast for specimen detail and to reduce glare. The density of the object also influences the degree of illumination. Stained structures, gram-stained smear of bacteria usually require more light than do unstained specimens.
All right, very good. And yeah, go ahead and read adjustment knobs too. I'm sorry.
Two adjustment knobs are used to bring the specimen into focus: the coarse adjustment knob and the fine adjustment knob. The coarse adjustment is used first to obtain an approximate focus quickly. The fine adjustment is then used to obtain the precise focusing necessary to produce a sharp, clear image. On some microscope models, the adjustment knobs are mounted as two separate knobs; on others, they are placed together with the smaller fine adjustment knob extending from a larger coarse adjustment wheel.
All right, very good. So on adjustment knobs, I want you guys to highlight the second and third sentence. All right, Lily, go ahead and read optical system and eyepiece.
Compound microscopes have a two-lens magnification system. Magnification is defined as the ratio of the apparent size of an object viewed through the microscope to the actual size of the object. The first lens system is the eyepiece or ocular lens, located at the top of the body tube and marked 10 times, meaning it magnifies 10 times. Microscopes that have one eyepiece only are called monocular microscopes, and microscopes with two eyepieces are called binocular. A binocular microscope is recommended for medical office laboratory work because it causes less eye fatigue than the monocular type. The binocular eyepiece can be adjusted to the individual by moving the eyepiece apart or together as needed.
All right, very good. All right. Dun, dun, dun. Natalie, will you please read objective lenses?
The second lens system consists of three objective lenses located on the revolving nose piece, each with a different degree of magnification. The metal shafts of the objective lenses differ in length and are identified by power of magnification. The short objective is known as the low power objective and has a magnification of 10x. The high power objective is known as a high dry objective because it does not require the use of immersion oil. It has a magnification of 40x. The oil immersion objective has the highest power of magnification, which is 100x. The degree of magnification is engraved onto the metal shaft of each objective. In addition, some microscopic manufacturers identify each objective lens by colored rings that encircle the metal shaft of the objective. Yellow is used for low power, blue for high power, and white for oil immersion. If the objective is not color coded, it can be identified by the length of the metal shaft. The lower power objective is the shortest, and the oil immersion objective is the longest. The objective lens magnifies the specimen, and the ocular lens magnifies the image produced by the objective lens. The total magnification of each objective is determined by multiplying the ocular magnification by the objective magnification. The total magnification of the lower power objective is 100 times 100x, the actual size of the object being viewed, 10 times x. 10 times 10. The total magnification of the high power objective is 40x, 10 times 40. And that of the oil immersion magnification is 1000x, 10 times 100.
Okay. So on the first paragraph, I want you ladies to highlight where it says the short objective is known as the low power objective and has a magnification of 10 times. The higher power objective is known as the high dry objective because it does not require the use of immersion oil. It has a magnification of 40 times. The oil immersion objective has the highest power of magnification, which is 100 times. All right, Sabrina, can you read focus and low and high power?
Depending on the type of microscope, two ways may be used to focus on a specimen. Some microscopes are equipped with a barrel focus. With this type of microscope, the body tube or barrel moves, while the stage remains stationary during focusing. Other microscopes focus on the specimen using stage focus. With this type of microscope, the stage moves while the body tube remains stationary during focusing. Low and high power. The low power objective is used for the initial focusing and light adjustment of the microscope. The low power objective also is used for the initial observation and scanning requirements needed for most microscopic work. Urine sediments is the first examined using the low power objective to scan the specimen for the presence of cats. The high power objective is used for more thorough studies such as observing cells in greater distance, defined as the distance between the tip of the lens and the slide is short when using this objective. Because of this, care must be taken in focusing the high power objective to prevent it from striking and breaking the slide or damaging the lens. Most compound microscopes are parfocal. This means that when the specimen is focused with low power objective, the nose piece can be rotated to the high power objective and focused simply with the fine adjustment knob.
Very good, thank you. All right, Talia, can you please read oil immersion?
The oil immersion object provides the highest magnificence and is used to view very small structures of the detail of large structures such as microorganisms and blood cells. The oil immersion object has a very short work distance, and when it is in use, the lens nearly rests on the microscope slide itself. A special grade of oil known as immersion oil must be used with this lens. Oil has the advantage of not drying out when exposed to air for a long time. A drop of oil is placed on the slide and resides between the oil immersions of objects on the slide. The oil provides a path for the light to travel on between the slides and the lens and prevents the scattering of light rays, which permits clear viewing of very small structures. The oil also improves the resolution of the object's lens, that is, its ability to provide sharp details, which is particularly necessary at a high magnification procedure that requires oil immersions include differential white blood cells counts and examination of ground stain smears.
Okay, so I actually just want you guys to highlight that last sentence. And under care of microscope on number 6, highlight that optical glass is softer than ordinary glass. To prevent scratching the lens, do not use tissue or gauze. And then I want everyone to go ahead and turn on over to page 723. All right, let's see here. Alicia, can you go ahead and read the first and second paragraph?
If the provider suspects that a particular disease is caused by a pathogen, he or she may want to obtain a specimen for analysis by an outside laboratory. This analysis identifies the pathogen causing the disease and aids in diagnosis. If a urinary tract infection is suspected, a urine specimen is obtained for bacterial examination. In this instance, a clean catch midstream collection is required to obtain a specimen that excludes the normal flora from the urethra and urinary meatus. A specimen is a small sample or part taken from the body to represent the whole. The medical assistant is often responsible for collecting specimens from certain areas of the body, such as the throat, nose, and wounds. The medical assistant should be responsible for assisting the provider in the collection of specimens from other areas, such as the cervix, vagina, urethra, and rectum. In most instances, a sterile swab is used to collect the specimen. A swab is a small piece of cotton wrapped around the end of a slender wooden or plastic stick. It is passed across the body surface or an opening to obtain a specimen for microbiologic analysis.
All right. So on the second paragraph, I want you guys to highlight the second sentence and then highlight where it says such as the cervix, vagina, urethra, and rectum. All right, Jasmine R., can you go ahead and read the next paragraph?
To prevent inaccurate test results, good techniques of medical and surgical asepsis must be practiced when a specimen is obtained. The medical assistant must be careful not to contaminate the specimen with extraneous These are undesirable microorganisms that can enter the specimen in various ways. They grow and multiply and possibly obscure and prevent identification of pathogens that might be present. To prevent extraneous microorganisms normal flora from contaminating the specimen, all supplies used to obtain the specimen, such as swabs and specimen containers, must be sterile. In addition, the specimen should not contain microorganisms from areas surrounding the collection site. When obtaining the swab should not be allowed to touch the inside of the mouth.
Okay. So highlight where it says the medical assistant must be careful not to contaminate the specimen with extraneous microorganisms. These are undesirable microorganisms that can enter the specimen in various ways. They grow and multiply and possibly obscure and prevent identification of pathogens that might be present. All right, Jasmine C.
Hold on, Miss Daniel.
Huh?
I kind of missed the first two highlighted parts before the last one you just mentioned.
Oh, on this second paragraph, highlight the second sentence. And then words such as the cervix, vagina, urethra, and rectum. And in the next paragraph, you'll highlight the second and third sentence.
All right, thank you.
You're welcome. All right, Jasmine C., can you read the next paragraph?
The OSHA bloodborne pathogen standard presented in Chapter 2 should be carefully followed when collecting a microbiologic specimen. Specifically, the medical assistant must wear gloves when it is reasonably anticipated that hand contact might occur with blood or other potentially infectious materials. Eating, drinking, smoking, and applying makeup are strictly forbidden when one is working with microorganisms because pathogens can be transmitted to the medical assistant through hand-to-mouth contact. In addition, labels for specimen containers should not be licked, and any break in the skin, such as a cut or scratch, must be covered with a bandage. If the medical assistant accidentally touches some of the material in the specimen, the area of contact should be washed immediately and thoroughly with soap and water. If the specimen comes in contact with the work table, the table should be cleaned immediately with soap and water, followed by a suitable disinfectant such as phenol. The work table also should be cleaned with the disinfectant at the end of each day.
Okay. So on this one, you're going to highlight the first sentence all the way till it says must be covered with a bandage. All right, Lily, go ahead and read the next paragraph. All right, very good. Natalie, can you read handling and transporting microbiologic specimens?
After the microbiologic specimen has been collected, Care should be taken in handling the specimen and preparing it for transport to an outside laboratory. Delay in processing a specimen for microbial culture may cause the death of pathogens or overgrowth of the specimen by microorganisms that are part of the normal flora usually collected along with the pathogen from the specimen site. Specimens transported to an outside medical laboratory are often placed in a transport medium. The transport medium prevents drying of the specimen and preserves it in its original state until it reaches its destination. Transport media are discussed in greater detail in this section on collection and transport systems. Outside laboratories provide the medical office with specific instructions on the care and handling of specimens being transported to them. These specimens must be accompanied by a laboratory request that designates the provider's name and address, the patient's name, age, and gender, the date and time of collection, the type of microbiologic examination requested, the source of the specimen, example, throat, wound, urine, and the provider's clinical diagnosis. The form usually includes a space to indicate whether the patient is receiving antibiotic therapy. Antibiotics may suppress the growth of bacteria, a factor that could produce a false negative result. A false negative result denotes a condition is absent when it is actually present.
All right, very good. All right, so in this second paragraph, I want you guys to highlight the first two sentences. Wound specimens. Wound specimens are collected using many of techniques described previously. In many cases, two swabs are used to collect the specimen. The specimen is obtained by inserting the swab into the area of the wound that contains the most drainage and gently rotating the swab from side to side to allow it to absorb completely any microorganisms present. The swab is placed in a specimen container and the process is repeated using a second swab. To obtain accurate and reliable test results, it is important to collect a specimen from within the wound rather than from the surface. Collection and transport systems. Microbiologic collection and transport systems are available to facilitate the collection of a specimen to be transported to an outside laboratory for analysis. Examples include a culturette and star swab tube. These systems consist of a sterile swab inside of a plastic tube that contains a transport medium. The transport medium prevents drying of the specimen and preserves it in original state until it reaches its destination. The collection of the transport system comes packaged in a peel-apart envelope and should be stored at room temperature. The procedure for the use of a microbiologic collection and transport system is outlined next. 1. Sanitize your hands and apply gloves. Check the expiration date on the peel-apart envelope. Peel back the package and remove the cap from the collection tube. Remove the cap swab unit from the peel-apart package. The cap is permanently attached to the sterile swab. Using aseptic technique, collect the specimen. Do not allow the swab to touch any area other than the collection site. Insert the swab into the collection tube. Push the cap swab in as far as it will go to immerse the swab completely in the transport medium. Make sure the cap is tightly placed. Remove gloves and sanitize your hands. Label the tube with the patient's name and date of birth, the date, the source of the specimen, for example, throat, wound, and your initials. Complete a laboratory request form. Place the collection tube in a biohazard specimen bag with a laboratory requisition form in the outside pocket. Document the procedure in the patient's medical record. Transport the specimen to the laboratory within 24 hours. All right, on page 725, I want you guys to highlight the first sentence under number 6, procedural step, and the last sentence on number 6, procedural step, and then highlight the first and last on principle of number 6. All right, we're going to turn our page to 726. Testing a microbiologic specimen in a POL. A microbiologic specimen may also be collected and tested in the provider's office laboratory, a POL, using CLIA-waived biochemical testing kits. The most common tests performed on microbiologic specimens in the medical office include CLIA-waived strep test and CLIA-waived influenza test, which are described in detail as follows. Streptococcal pharyngitis, strep throat. The most common streptococcal condition is streptococcal pharyngitis, or strep throat, which is a bacterial infection of the back of the throat and tonsils. Highlight that sentence. The causative agent of strep throat is a group A beta-hemolytic streptococcus, known as Streptococcus pyogenes. Strep throat is seasonal in nature, with the highest prevalence occurring during the winter and early spring. Strep throat occurs most frequently in children ages 5 to 15 years old. Highlight that sentence. Symptoms. The symptoms of strep throat include the following. Highlight every single one of these bullet points. Severe and sudden sore throat, fever of 101 degrees Fahrenheit or higher, red or swollen tonsils, white patches or streaks on the throat and tonsils, severe pain and difficulty upon swallowing, tender and swollen lymph nodes on the sides of the neck, tiny red spots at the back of the roof of the mouth, and a headache. Strep throat can easily be spread from one person to another through droplet infection and by sharing personal items with an infected person, such as eating utensils. The incubation period for strep throat ranges from 1 to 3 days, with most patients recovering within 7 to 10 days. Strep throat is a potentially serious condition because, although rare, some patients develop a post-streptococcal complication. A post-streptococcal complication is a morbid secondary condition that occurs as a result of a less serious primary infection. Highlight that sentence. Occasionally, a patient with strep throat primary infection develops rheumatic fever or acute glomerulonephritis. Highlight that sentence. Owing to the risk of a post-secondary complication, early diagnosis and treatment of strep throat with antibiotics is important. Yep, so did I, Alexis. We still get it. Me and my girls do. All right, CLIA-waived streptococcus testing. Let's see here. Sabrina, please, the first and second paragraph. Talia, can you go ahead and read the first two paragraphs?
In the medical office, a rapid antigen detects the test is often used for identification of the group a beta hemolytic. What they say?
Yes.
Streptococci. Rats are immunoassay tests for the qualitative detection of group A streptococcus. They are easy to perform and provide results in a short period of time. Rats are biochemical tests that detect group A streptococcus from a throat swab in a very short time. Most tests require only 4 to 10 minutes to proceed. Diagnosis can often be made and antibiotics prescribed if necessary before the patient leaves the office. A rat confirms the presence of a group A streptococcus through an antigen antibody reaction. The test works by combining particles sensitive to the streptococcus antibody with the throat specimen. If group A streptococcus antigen is in the specimen, it combines with the antibody sensitive particles to produce a color change that can be observed with the unarmed eye. Rapid streptococcus tests also include an internal control that determines whether the test results are accurate and reliable.
All right, very good. So in the first paragraph, I want you guys to highlight where it says in the medical office, a CLIA-waived rapid antigen detection test, RAT. And then highlight that RATs are biochemical tests that detect group A streptococcus from a throat swab in a very short time. Most tests require only 4 to 10 minutes to process. Now, really quickly before we go any further, the collecting a specimen and doing a strep and a flu test is something that, because of COVID, I cannot show you when we get to the clinic. So I do advise you guys to read the procedures in this chapter pretty good. All right. The advantages of a RAT is that it gives the provider immediate test results rather than requiring an overnight culture. Specific instructions are included with every commercially available CLIA-waived RAT. Examples of these tests include the QuickVue Inline Strep A, that's the most common one, OSIM Strep A test, and Bionex Now Strep A test. The procedure for performing a CLIA-waived RAT is presented in procedure 20.3. And y'all, reading this already makes my throat hurt. I hate strep. All right, case study number 2. Paula Hutchinson brings her 8-year-old daughter, Caitlin, to the medical office. Caitlin has had a fever, sore throat, and difficulty eating for the past 2 days. The physician orders a rapid strep test. Caitlin refuses to open her mouth so that the specimen can be collected. She says that she does not want that swab thing in her mouth because she's afraid it will make her throw up. Paula wants to know why the strep test must be run. She says that Caitlin's throat is very red with white patches and wants to know why the physician doesn't just prescribe an antibiotic for her without running the test. All right. What would you do?
Explain to her that the test has to be run, like you can't just prescribe her medicine without actually getting results.
That's right. Yep. Alexis, that's right. Yeah, I mean, she has the common symptoms of strep, but we need to make sure that that's what it is, because if not treated, it can lead to some serious problems. All right, anything else? So for those that are wanting to do pediatrics, this is a good case study. How would you get your patient to do the test?
Hold on, Miss. Let me read the study real quick.
You could maybe like get on her level in a way that you can explain it to her a little deeper than just like we're gonna stick something in your throat. Make her more comfortable and tell her like how you're gonna do it, that it's gonna be over in just a couple seconds. Like it'll make you feel better too after you do it, because then the doctor can give you some medicine.
Yeah. If you've ever been to a pediatric office, what are some common things that you will find?
Suckers.
Okay, you said how to get the child to allow it to swab her throat. Is that what you were asking?
Yeah, I mean, how would you get the patient to do the test, right? What are some ways?
One of the things that I did was I always spoke to the patient. I always, according to their age, of course, but I always spoke to them and I let them know exactly what I was doing and what to expect. And I would use words that they would understand. And then, of course, I would let them know ahead of time that, once it was all over, that they would get a sticker. Whether it was a sticker we were giving, or some places give out little lollipops
right.
or not. And then she would get a beautiful little Band-Aid.
Yeah. Yeah, so I mean, you could really, pediatrics is a fun way, right? Like most of the time, you can't bribe an adult, right? I mean, there's just not, there's really not much that you can offer them that may, want them to do it. But yeah, for kids, I mean, you can do suckers, stickers, treasure boxes. Yeah, or compared to their favorite superhero. Yeah. Ooh, I like the smelly stickers and the smelly markers. Those are always my favorite. Although you wouldn't find that in a pediatric, but still. Yeah, so very good. All right. Any questions on that?
No.
All right. So that was our strep testing. Now we're going to do our influenza. Influenza, commonly called the flu, is a highly contagious acute infectious disease caused by viruses that infect the respiratory system, nose, throat, and lungs. According to the Centers of Disease Control, CDC, approximately 5 to 20% of the U.S. population will contract it each year. Influenza outbreaks are the most apt to occur between late fall and early spring, November through April. There are 3 different types of influenza viruses, A, B, and C, which are described as follows. Influenza, Alexis, they should do those for adults too. Influenza type A. This is the most prevalent and is responsible for most annual influenza outbreaks. Highlight that sentence. It causes moderate to severe illness and at times can lead to serious complications and death. Influenza A can be further divided into numerous subtypes. For example, H3N2, H1N1. H1N1 was awful. Are subtypes of the influenza type A. Influenza type B. This type can cause influenza outbreaks, but it usually is associated with less severe infection. Highlight those words. Than type A. Influenza
Miss
type.
Daniel.
Yeah.
Oh, I was good. Okay, never mind. I was about to ask, wasn't the H1N1 the flu, the swine? But I just saw it.
Yeah. Yeah, that was awful. Alexis asked, can you develop pneumonia with the flu? In some cases, yes. A lot of our older population, they more than likely will probably develop both. All right, influenza type C. This type only causes a mild upper respiratory illness and occurs much less frequently than types A and B. Transmission and incubation period. Influenza spreads easily from one person to another. It is transmitted primarily through droplet infection from the respiratory tract of an infected individual when they cough, sneeze, or talk. Highlight those 2 sentences. Influenza is less frequently transmitted through indirect contact, such as when a person touches an object or surface that is contaminated with the influenza virus and then touches his or her mouth, eyes, or nose. An individual usually becomes infected with either type A or type B influenza, but it is in rare instances an individual may become infected with both type A and B influenza at the same time. The incubation period for influenza is usually 2 days, but it can range from 1 to 4 days. Highlight that sentence. An infected individual is contagious approximately 24 to 48 hours before the onset of symptoms and up to 5 to 7 days after symptoms appear. What does that sound like, ladies? Yes. All right. Symptoms. In early stages of influenza, symptoms may be difficult to distinguish from those of a common cold. However, colds usually develop slowly, whereas the flu has more of a sudden onset and the symptoms are much worse. Symptoms of the influenza vary by age, but are commonly include the following. Highlight every single one of these bullet points. Fever and chills, muscle aches and joint pain, sore throat, runny nose, nasal congestion, dry cough, headache, joint pain, anorexia, fatigue, gastrointestinal symptoms such as nausea, vomiting, and diarrhea. Rona. Yep, good old Rona. All right, complications. Influenza can occur among people of all ages. Most individuals with a healthy immune system recover within 7 to 14 days, with the worst symptoms lasting 3 to 4 days. There are certain factors that can increase an individual's risk of developing serious and even life-threatening complications from influenza. These risk factors can be categorized in health-related factors and age-related factors and are presented in box 20.1. Highlight that sentence. Influenza complications range in severity and can include the following: viral pneumonia, a worsening of a chronic medical condition, a secondary bacterial infection such as bacteria pneumonia, bronchitis, sinusitis, and otitis media. Highlight that sentence. Some of these complications can lead to hospitalization and even death. Because of this, individuals with risk factors should seek prompt medical attention at the first sign of a flu-like symptom. Most, but not all, of flu-related deaths occur in individuals 65 years of age and older. Prevention. The primary means of preventing influenza is through an influenza vaccine and infection control measures, which are discussed in more detail as follows. Influenza vaccine. The best means of preventing influenza and its complications is through an annual influenza vaccination. Highlight that sentence. The vaccine is recommended for all individuals aged 6 months and older who do not have contradictions to receiving the vaccine. For example, severe egg allergy. The vaccine provides protection against both type A and B influenza viruses. As previously discussed, there are numerous subtypes of influenza type A. Small changes continuously take place in the genetic material of these subtype viruses, resulting in new strands developing to replace of older strands. Because of this, a new vaccine must be produced each year to provide protection against the most recent strains predicted to be circulating during that year's flu season. Okay. On page 727, before I go further, highlight that first sentence and where it says, because of this, a new vaccine must be produced each year. It takes approximately 2 weeks following vaccination for the antibodies to develop that provide protection against the virus strands included in the vaccine. Highlight that sentence. The flu vaccine provides reasonable protection among healthy adults. Vaccination is the most effective when the circulating virus strands are well matched with the virus strands included in the vaccine. Even if the vaccine does not prevent the flu, however, it can reduce the severity of symptoms and decrease the risk of complications. Highlight that sentence. The influenza vaccine has only mild side effects or none at all and is available as an intramuscular injection, an intradermal injection, or a nasal spray. Flu vaccination is... Okay. Make sure y'all close the door behind you. Flu vaccinations are offered in many locations within a community, such as medical office, health departments, pharmacies, college health centers, workplaces, and even schools. Many communities have programs that offer the vaccine free of charge or at a reduced cost. All right, really quickly, let's look at box 20.1. Under the health-related factors, please highlight each bullet point. Asthma, chronic bronchitis, emphysema, cystic fibrosis, diabetes, heart disease, kidney or liver disorders, blood disorders, very severely obese, disease or treatments that weaken the immune system, HIV, AIDS, treatment with corticosteroids, immunosuppressants, or chemotherapy. For age-related factors, highlight these 2 bullet points. Adults age 65 years and older, young children under 5 years of age, but especially children younger than 2 years of age. Any questions so far? Okay. Infection control measures. Infection control measures provide reasonably effective ways to prevent the transmission of influenza. Highlight that sentence. These measures include the following. Number 1, practice good hand hygiene. Highlight those words, such as frequent hand washing or the use of an alcohol-based hand rub. Number 2, avoid close contact with infected individuals. Highlight that sentence. Number 3, try not to touch your eyes, nose, or mouth. Highlight those words to prevent the influenza virus from gaining entrance into your body. Number 4, always cover your nose and mouth when you cough or sneeze. Highlight that sentence. To avoid contaminating the hands, cough or sneeze into a tissue or the crook of the elbow. Number 5, if infected with influenza, stay home. Highlight those words. From work, school, or public places for at least 24 hours. Highlight those words. After the fever has subsided. Treatment. Treatment for influenza primarily involves home care measures to ease the symptoms, but may occasionally involve the use of an antiviral medication. These treatment measures are discussed in more detail as follows. Most people who contract influenza recover on their own without medical intervention. Home care is usually all that is necessary to treat the symptoms of influenza. These measures are outlined as follows. Get plenty of rest. Increase fluid intake to stay hydrated. Avoid the use of alcohol and tobacco. Take over-the-counter medications to relieve symptoms of disease. Do you ladies know what over-the-counter type medications you could recommend for your patients? Granted, this is also if your doctor agrees with this, but what do y'all think some of those would be?
You could do the ones for cold and flu.
Yeah, you can, like NyQuil maybe.
Yeah.
Maybe. Yeah, those are options. What else? Theraflu, yeah. Oh, you spelled it right.
I missed the question. Sorry, I was with the guest.
No, you're good. What are some over-the-counter medications that you could recommend to your patient if they were diagnosed with influenza? NyQuil, yep.
Definitely the Thermaflu.
Yep, Thermaflu, NyQuil, yep. There are a couple of newer ones out that I personally recommend. Do y'all think you can guess? Delsum, yeah, Delsum's good for cough.
What I'm thinking of, I can't think of the name.
So elderberry is the first one. And if have you guys heard of the medication that you can give a patient for the flu that helps relieve their symptoms faster? Do any of you know that name?
No, so please share.
Okay, so there is an over-the-counter medication that is similar to that. Name of it is... All right, I'm going to type it.
Is it the homeopathic one?
Huh?
Is it the homeopathic one? There's one that works really good, and it's homeopathic. Yeah, that's the one!
Yep.
I've used that. That works so good.
It does. And if you pair that up with the elderberry that's over the counter, you're good. I found that's worked really, really well. All right. Any questions so far? You guys are doing good. We're almost done. Vapor rub to me can cure anything. I love me some vapor rub or some mentholatum, which it's hard to find mentholatum. I just like the smell of vapor rub. Ooh, especially the vapor rub lavender. All right. Antiviral medications. Let's see here. Alicia, go ahead and read antiviral medications.
Antiviral medications are available by prescription and work by limiting the multiplication of the influenza virus. Antiviral medications lessen the severity of the influenza and shorten the duration of the disease by 1 to 2 days. They are not intended, however, to serve as a substitute for an annual influenza vaccine. Antiviral medications are recommended primarily for unvaccinated individuals who are at risk of developing complications from influenza. See box 20.1. There are 3 antiviral medications recommended by the Food and Drug Administration for the treatment of influenza. These include oseltamivir, Tamiflu, zanamivir, Relenza, and Paramivir. I don't know if I'm saying that right. Rapipab. These antiviral medications are effective against both influenza viruses type A and B and must be started within the first 48 hours of developing symptoms to be most effective. Because of this, individuals at risk for influenza complications are encouraged to contact their providers at the first sign of flu-like symptoms.
All right, very good. So you're actually going to highlight all of that first paragraph. And in the second paragraph, highlight these antiviral medications are effective against both influenza viruses type A and B and must be started within the first 48 hours of developing symptoms to be most effective. Oh, really, Natalie? That's interesting. All right, CLIA waived influenza testing. In the medical office, a CLIA waived rapid influenza diagnostic test, RID, may be used to assist in the diagnosis of influenza. RIDs are immunoassay tests for the qualitative detection of the influenza virus antigen. They are biochemical tests that are easy to perform and provide results within a short period of time, 15 minutes or less. Okay, learn something new. In the majority of cases, influenza is diagnosed solely on the clinical signs and symptoms exhibited by the patient. Highlight that sentence. This is because flu symptoms are self-limiting and most individuals recover without requiring medical treatment. An influenza test may be ordered for a patient who is at high risk for developing influenza complications as a basis for prescribing medication such as an antiviral drug. Rapid influenza tests vary in their ability to detect type A and type B influenza viruses. Each RID detects the influenza virus in one of the following ways. Number 1, detects the presence of influenza virus without identifying the type. Number 2, detects only influenza type A virus. 3, detects the presence of type A and B influenza virus, but does not distinguish between the two. Detects and distinguishes between the presence of type A and type B influenza. It is important to perform a rapid influenza test as close to the onset of symptoms as possible, preferably within the first 2 days after symptoms appear. As previously discussed, in order for an antiviral medication to be effective, it must be administered within 48 hours following the onset of symptoms. In addition, a patient infected with the influenza virus is most apt to show a positive test result within the first 3 to 4 days after the appearance of symptoms. The main disadvantage of RIDs is that there is a high rate of false negative test results. Because of this, Centers of Disease Control, CDC, recommended that anticipated treatment not be withheld from patients with suspected influenza, even if the patient tests negative. More specific tests are available, for example, viral cultures, that can be performed by an outside laboratory. However, it can take 2 to 10 days to perform the test and obtain the results. The specimen required to perform the RIT depends on the brand of the test being utilized and includes one or the more of the following: nasal pharyngeal swab specimen, nasal swab specimen, nasal wash, nasal aspirate, and throat specimen. The influenza virus is most likely to be found in the nasal pharynx. Oh, cool. A nasal pharyngeal swab is considered the preferred specimen for the rapid influenza test and is discussed in more detail next. Really cool. Just be careful with it. All right, nasal pharyngeal swab specimen. Jasmine R., can you please read the first 2 paragraphs?
The nasopharynx of the soft palate that is directly continuous with the nasal passages. This is an area from which a nasopharyngeal swab specimen is collected for the detection of the influenza virus. The influenza virus invades epithelial cells in the nasopharynx, therefore a specimen obtained from this area is preferred for RADT testing. The preferred specimen collection device for a nasopharyngeal specimen is a flocked swab. A nasopharyngeal flocked swab consists of a flexible shaft with a small brush-like tip, figure 20.6. The shaft of the swab has a thicker diameter at one end, where it is held, and progressively narrows to a thinner end, culminating in the soft brush tip. The tip is coated with short nylon fibers that are arranged in a perpendicular manner. This arrangement results from a process called flocking, in which nylon fibers are sprayed onto the tip of the swab. Flocking results in a more abrasive tip swab and leads to the removal of a greater number of epithelial cells from the nasopharynx.
All right, very good. Jasmine C., can you go ahead and read the next paragraph?
The depth to which the swab should be inserted is specific to each patient. For example, in order to reach the nasopharyngeal, how do you say that?
Nasal pharyngeal.
Mucosa. The swab must be inserted to a great depth in an adult than that of a child. It is possible to determine the distance to which the swab should be inserted by visually estimating the distance between the corner of the nose and the earlobe. The swab should be inserted approximately 1/2 this distance. The depth usually falls between 4 to 6 centimeters, approximately 1.5 to 2.5 inches. The procedure for collecting a nasopharyngeal swab specimen and performing a CLIA weighted RIDT is presented in procedure 20.4.
All right, very good. All right, let's go to page 730. Case study number 3. Holly Dolly, age 18, is at the medical office complaining of fatigue, fever, headache, muscle aching, runny nose, and a sore throat. Holly also has severe problems with asthma, which began when she was a child. Holly just enrolled in a medical assisting program and has really been worried about doing well in her classes. The physician ordered a rapid influenza test on Holly, and it is positive. The physician writes a prescription for an antiviral medication and advises Holly to get plenty of rest, increase her fluid intake, and stay at home for at least 24 hours after the fever has subsided. Holly says she doesn't know why she has the flu because she got a flu vaccine a week ago. Holly also wants to know why the physician did not prescribe an antibiotic for her so that she could get well sooner and not have to miss any classes. All right. What would you do?
Inform her the reason that she got the flu was because the vaccine takes up to 2 weeks to, actually work in that way.
That's right. So yeah, most vaccines have the virus in it, but your body still has to absorb it. Yeah, it it does. So, but it's not going to be done overnight. So it still takes a while for your body to recognize that antibody and start fighting it.
You can tell her that you understand that she doesn't want to miss any class, but it's important for her and for the students that she's going to be around that she doesn't pass it on to them or she's not contagious from her fever or anything.
Yeah, that's right. So at this point, as long as she's running fever and even has symptoms, she's considered contagious. And no, we all hate to miss stuff, but we also don't want the patient to get worse, right? Because if you overexert yourself when you have the flu, you can end up being in the hospital, right? Like you literally need to hydrate, rest, and just treat your symptoms. But if you don't do that, it can cause problems, and we don't want that for her either. All right, anything else?
Good. They don't usually give antibiotics for the flu, do they?
No. No.
So maybe explain to her why.
Yeah, they may prescribe antiviral, but antibiotics is not going to do anything for this.
Antibiotics isn't going to cure it.
Yeah. Yeah, they may do an antiviral, but not an antibiotic. No. All right, very good. Well, what do we not want to do? Yeah, just get to rest and let it pass. Yeah. All right, what do you not want to do? Yep, that's right, Lucy. We don't want to tell her that she just needs to go ahead and go to school. Nope. We want to really encourage her to go home and rest, and then she can return. Right. Yeah, give her a doctor's note. That way, that kind of protects her, right, with school and maybe work. Most places now you have to have a doctor's note. Yep, that's good. All right, very good. So let's go on over to page 736. All right, culture and sensitivity testing. Has anybody heard of this before I just said it?
I took microbiology at Navarro and we did it.
Yep. All right, kind of explain to me what culture and sensitivity testing is.
Well, so we got like these little discs and we put them on the what are they called? The culture plates? Like the
On the what?
on the plates,
Uh-huh.
like the culture plates.
Mm-hmm.
Oh, we did that. But yeah, like and we also got
Petri dish.
like we would swab stuff and put it onto like the blood of our plates, and then we would watch it like grow.
Yeah, you would see if it would grow, and then you could actually put medications on it or vaccines, anything like that on it, and you'll see if it kills the viruses. So this is really cool. That is correct, Elisa. Yes, that is one of the abbreviations. Yes. So when we do cultures, This is one reason why our doctors do like to do our cultures and send them off to a laboratory and do the culture and sensitivity testing. All right, so let's see here. Lily, please read the first 2 paragraphs under microbial cultures.
After a microbiological
Biological specimen is collected and transported to an outside laboratory and may be examined to determine the type of microorganisms present. Because most specimens generally contain only a few pathogens, it is often desirable to induce any pathogens that are present to grow and multiply. Most microorganisms, especially bacteria, can be grown on a culture medium. A culture medium is a mixture of nutrients on which microorganisms are grown in the laboratory. The culture medium and the environment in which it is placed must meet the requirements to support and encourage the growth of the suspected pathogen. These growth requirements include the presence of the absence of oxygen, depending on the microorganism, proper nutrition, temperature, and pH and moisture.
Very good, thank you. All right, Natalie, please read the next 2 paragraphs.
The culture medium may be solid or liquid. Blood agar is one of the most frequently used solid culture media. It is prepared by adding sheep's blood to a substance known as agar, which is transported and colorless. Blood added to the agar provides nutrients that support the growth of a variety of bacteria. When heated, it melts and becomes a liquid. On cooling, agar solidifies, forming a firm surface on which microorganisms can be grown. A liquid culture medium is often referred to as a broth, and it is usually contained in a tube. An example is nutrient broth. Culture media must be stored in the refrigerator and warmed to room temperature before use. A cold culture medium must not be used because of the cold temperature results in the death of microorganisms placed in it. A Petri plate is frequently used to hold solid culture medium. The plate consists of a shallow circular dish made of glass or clear plastic with a cover, the diameter of which is greater than that of the base. Microorganisms can be cultured on the surface of the medium in the plate, figure 20.8. Petri plates allow examination of a culture while preventing microorganisms from entering or escaping. A culture is a mass of microorganisms growing in a laboratory culture medium.
Very good, thank you. All right, so you're just going to highlight that last sentence where it says a culture is a mass of microorganisms growing in a laboratory culture medium. All right, Sabrina, please read the next 2 paragraphs. Oh, not a problem. Talia, can you please read the next 2 paragraphs?
Solid culture medium in a Petri plate is inculcated by rolling the swabs containing the specimen of the surface of the medium. The cover of the Petri plate should be removed only when the specimen is being spread on the culture medium. Unnecessary removal of the cover results in a contamination of the medium with extraneous microorganisms. The culture is incubated for 24 to 48 hours in conditions that encourage the growth of the suspected pathogen. Most specimen tapes for analyze contains a mixture of organisms because of the presence of normal flora in most parts of the body. When this is the case, the resulting culture is known as a mixed culture, or one that contains 2 or more types of microorganisms. To analyze most microbiologic specimens, the suspected pathogen must be separated from the mixture culture and permitted to grow alone. This established a pure culture, or a culture that contains only one type of microorganism. After the culture has grown sufficiently, the appropriate tests are performed to identify the pathogen. It is impossible to grow viruses by this method. Rather they must be cultured on living tissues or identified using serologic tests.
Very good, thank you. All right, in the first paragraph, you're going to highlight the first sentence, or I'm sorry, the last sentence, where it says the culture is incubated for 24 to 48 hours in conditions that encourage the growth of the suspected pathogen. And in the next paragraph, you're going to highlight the second sentence. When this is the case, the resulting culture is known as a mixed culture, or one that contains 2 or more types of microorganisms. All right, Alicia, if you will read sensitivity testing.
The provider may test not only that the laboratory identify the infecting pathogen, but also that a sensitivity test be performed on it to determine the best antibiotic to treat the condition. The test is always performed on a pure rather than a mixed culture. A sensitivity test determines the susceptibility of a pathogenic bacteria to various antibiotics. Only the growth of the infectious pathogen is desired on the culture. A common method for sensitivity testing is the disc diffusion method. Commercially prepared discs impregnated with known concentrations of various antibiotics are dropped on the surface of a solid culture medium in a Petri plate inoculated with the pathogen. The culture is incubated, allowing the antibiotics to diffuse into the culture medium. If the pathogen is susceptible or sensitive to an antibiotic, a clear zone without bacterial growth surrounds the disc. This indicates that the antibiotic was effective in destroying the pathogen. If the pathogen is unaffected by or resistant to the antibiotic, no clear zone is seen around the disc, indicating that the antibiotic was unable to kill the pathogen. Sensitivity testing enables the provider to decide which antibiotics would most likely be effective against the infectious disease in question.
Very good. Okay, so in the first paragraph, I want you guys to highlight the first sentence. And in the second paragraph, highlight where it says that the pathogen is susceptible or sensitive to an antibiotic. A clear zone without bacterial growth surrounds the disc. And if you look at figure 20.9, that's an example. Prevention and control of infectious diseases. Individuals in the community can help prevent and control infectious diseases by practicing good techniques of medical asepsis, by obtaining proper nutrition and rest, and by using good hygiene measures. In addition, infected individuals should contact their providers in an effort to ensure early diagnosis and treatment of the infectious disease. Immunizations are available to prevent a wide range of infectious diseases. The medical assistant has a responsibility to help community members about practices that reduce the transmission of pathogens and help control and prevent infectious disease. All right, any questions?